Hello everyone, I am Dr. Suraj Narasimhan, interventional cardiologist and structural interventional specialist working in Narayana Health City, Bangalore. Today I am going to talk about an interesting topic called as a mitral valve and also what are the latest advanced therapies which we have for mitral valve diseases. Basically, heart has 4 valves, out of which one of the important valve is the mitral valve, which is situated between the left atrium and the left ventricle. The normal function of a mitral valve is to allow blood to go only in one direction. It can allow the blood from the left atrium to the left ventricle so that it can be pumped outside the body, and it doesn't allow the blood to go in the opposite direction. That is what a normal mitral valve does. But whenever it has issues like regurgitation, that is a leakage, the blood rather than going from the left ventricle to outside the body, it is going in an opposite direction back into the left atrium. This over a course of time leads on to dilatation of the heart chambers, and then the pressure inside the heart builds up. When the pressure inside the heart builds up, it is getting transmitted to the lung, and invariably the patient will end up with breathing difficulty and also starts collecting fluid inside the lung, which is known as pulmonary edema. So this regurgitation is not always dangerous. We classify this regurgitation into 3 groups. One is a mild regurgitation, the second is a moderate regurgitation, the third one is a severe regurgitation. Mild and moderate regurgitations can be treated with medications and that it can be controlled. But whenever this leakage becomes severe and the dilatation of the heart starts developing, then we have to do something for the leakage, and there are 2 possibilities for this kind of an issue. One is to surgically repair or replace the valve. The other interesting thing which has come into the practice right now is called as the mitral tear procedure, and otherwise called as the MitraClip procedure. Here what we do is, rather than going in for an open heart surgery, cutting open the chest, stopping the heart, repair or replacing with an open surgery, we will do it in a beating heart procedure. This is a very simple procedure wherein you just put a small hole in the leg through which we go inside the heart, and then with 3D echocardiographic guidance we will be exactly able to pinpoint the location where the leak is happening. Once we find out this is the location, and then if the location is good enough to put a clip over there, we can just introduce some catheters inside and then put a clip in that place where the leakage is happening. This completely reduces the mitral regurgitation, thereby improving the patient's symptoms as well as prevents the heart from getting further damaged. So this mitral clip procedure is not for all patients. It is predominantly for patients who are elderly, who have very high surgical operative risks. There are many advantages which we get with a mitral tear procedure. First is that it is a much simpler procedure when compared to open heart surgery. The patients usually get admitted the day prior, the next day the morning procedure happens, and the next day he is fit enough to get discharged. His ICU stay is going to be very minimal, usually 12 hours of ICU stay and 1 day of hospital stay. The next day the patient will be walking on their own, and their recovery is so faster that within a week's time they go back to their normal activities. And the second aspect is it is much safer when compared to open heart surgery. Here we don't cut open the chest, we don't put the patient on bypass, we don't put the patient, stop the heart, and then we don't do surgeries. Here the surgery is done through a pinhole in the leg, so there is no pain, there is no scar, as well as the rate of infection is going to be much lesser. The second advantage is that it is going to be less invasive. Whenever it is a less invasive procedure, the complications which are associated with the operation is going to be much lesser. So the major advantages are going to be less invasive, scarless, painless procedure which offers better therapy for patients who are elderly, who have high operative risk, and then thereby their quality of life as well as their morbidity and mortality can be reduced as low as possible. Thank you.